Mr. Chairman, thank you so much for organizing this hearing. To our colleagues from NIH, this is the committee that's, and the members here today are the pragmatists. When you look at us, we have a chairman that's very much dedicated to NIH, certainly a vice chairman that is. We have the authorizers here in terms of Murray and Alexander. All of us here going around have a history of support for this. So you've got people who really want to be nonpartisan. So I want you to know that.
Thank you.
We are stymied. We are stymied by our own processes. When I first arrived in the Senate, we had a triad that worked. Authorizing, they would often create great policy on a bipartisan basis. Kennedy Hatch, Kennedy Casabell, et cetera. We had appropriations that really could move the ball forward. And we had a budget process that gave us an orderly methodology process for doing that. So we got problems here. So we got big problems here. And I know that you live them out every single day. Colleagues, when I visit the National Institute, which has been my great joy to represent for 28 years, I call it the National Institutes of Hope. This is what we just heard here, the National Institutes of Hope, and both what they do on the campus in Bethesda, but also what they do through the great extramural research like in the University of Maryland and Johns Hopkins. Dr. Lorsch, you're a Hopkins guy. They're going to dedicate a room at the Hopkins Club, the faculty club, 2 weeks from now. 38 people associated with Hopkins have won the Nobel Prize. 2/3 of that have been in life science. 38 people, one university, but because of the role that our government plays in doing that. But we're an economic engine. When you think about the jobs that are created because of you in pharmaceuticals, biomedicals, medical devices, you are a turbo engine. So rather than seeing you a cost factor, we should see you as an economic generator, And I hope that we can be able to do that. I'm deeply concerned about the caps. I don't like budget caps, but most of all, I don't like the caps on innovation. We cannot continue to cap innovation. We cannot cap breakthroughs. We cannot cap the opportunity for young people to dream for these careers like Dr. Rosenberg and all of you have here. So here is my question to you, that when we look at both the research to be done and the workforce that needs to do it, I worry about the young investigator and the debt that they carry that's a deterrent to pursuing this. Could you tell me, if we could go down the table, if we lifted the caps and went to President Obama's budget, nothing more, President Obama's budget, what would be the three things each and every one of you could do, and how would it also impact young investigators?
Okay, folks, there's the challenge. Maybe we should just quickly go down the table. Nora, do you want to kick this off?
Three.
Turn your mic on.
But if you just have one,
No,
one would be enough. So,
But number one is we would accelerate the development of medications for addiction. There are many very potentially interesting targets, but since pharmaceutical industry is not investing, the responsibility relies in federal government money, predominantly through the NIH. So that would be one. The second one would be to have to expand the study to understand how drugs affect the development of the human brain. We now have the technologies. We should have that information. And that will inform prevention efforts. And the third one will relate to actually making research more accessible to the young investigators so that we don't lose talent.
I would just expand upon that. I would say that there's the three areas I would focus on are the young investigators. We know that there are two critical points in which an investigator is likely to stay in research or exit. One is on their first application to get a grant. The second is getting that renewed. And if they get that through that second hurdle, it's likely that they're going to be with us a long time. So we'd like to encourage them by making incentives for both the first application as well as the first renewal. The other point that I would make is that with expanded funds, we would be able to allow for expansion of some of our existing clinical studies, which are very expensive because of the curtail that we'd have to do. And one way to amplify the investment in infrastructures in these clinical trials is by having ancillary studies to these trials. So I would expand existing trials as well as ancillary studies to these trials.
Thank you, Senator Mikulski. The question of young people, we at NCI are in the process of trying to develop new approaches to enhance their ability to move from being graduate students and postdoctoral fellows to starting their own laboratories. And the areas where we would invest would be in cancer prevention, cancer screening, and cancer treatment using molecular precision medicine approaches, which have enormous potential in those areas. And I would highlight the potential of immunotherapy, as was discussed earlier, because of the issue of its potential for improved responses, decreased side effects, and scalability, as Senator Blunt mentioned.
In terms of research projects, we talked about the BRAIN Initiative. There's also the National Action Plan for Alzheimer's Disease Research, and all of those have milestones. It's all planned out. If we had funding, we could really accelerate both of those major projects. I think in terms of the young people, I think it's incredibly important. The average age of becoming independent with an NIH grant is now going towards the mid-40s. We got to move that down. I think we have a couple of things that we're playing with at NINDS to just take a shot at somebody who's really young, who really looks bright, and just give them a chance much, much earlier in their career.
So my institute mostly funds fundamental basic research, and the great ideas that lead to the discoveries that Dr. Collins told you about in basic research don't come from me, and as much as I esteem my colleagues, don't come from them. They come from the great, brilliant minds at the universities and institutions in your districts across the country. And so we would focus on supporting investigator-initiated research to promote these brilliant scientists to do their work. And as a measure of that, and the success of that, my institute, as Dr. Collins alluded to, has funded a number of Nobel Prizes, and I would have said 81 yesterday, but as of this morning, it's now 83. I think that's an indication of the power of investigator-initiated research. And we would certainly have a focus on promoting the careers of the young scientists who will win the Nobel Prizes of the future.